Hello everyone. In this session, we are going to discuss a very important topic, that is gallbladder carcinoma. So in your university exam, you usually get a long question on the malignancies, on oncology or carcinomas. So one of the important carcinomas is gallbladder carcinoma from exam point of view. So let's start it. Gallbladder carcinoma. So like all cancers, like all carcinomas, I will also discuss this carcinoma under a fixed set of headings. So first of all, I will let you know the introduction. Then I will let you know the most common age of presentation of gallbladder carcinoma. Then we will see the gender prevalence. Then we will see etiology, site, gross. Most important is the microscopy, clinical features and spread. So I request all my dear students to describe all the malignancies under these headings only. So learn this overview under which you have to frame your answer. If it is coming as a long answer, you have to frame under these headings. And if it is coming as a short answer, then whatever is asked, just write down that only. So let's start it. So let me tell you the introduction of gallbladder carcinoma. Gallbladder carcinoma usually remain undetected until it is widely spreaded in the body and it become inoperable. I mean to say, in early stages, it is usually undetectable because the symptoms are very mild and it get unnoticed. But whenever it is widespread and it become inoperable, then the symptoms become severe. At that time it become detectable. So that is the misery here. So that is the introduction. Now, most common age of presentation, it presents in the 7th decade of life. So usually it presents in old age, and among the gender, it is 4 times more common in female as compared to male. So it is 4 times more common in female as compared to male. So that is about the introduction of the gallbladder carcinoma. Now coming on the etiology. By etiology, I mean the risk factors. So what are the risk factors of gallbladder carcinoma? The most important risk factor is the stones, the gallstones. The gallstones is known as cholelithiasis. So in 70% of the patient having gallbladder carcinoma, they have a history of cholelithiasis. So cholelithiasis is one of the most important, the biggest risk factor. And the second risk factor is cholecystitis. So acute or chronic cholecystitis. So cholelithiasis and cholecystitis are the two most important risk factors for gallbladder carcinoma. The second is chemical carcinogens. There are many chemical carcinogens like the nitrosamines, pesticides. The person who work in rubber industry are at high risk of developing gallbladder carcinoma. And there are certain miscellaneous factors like the persons who have a previous surgery on the biliary tract may have gallbladder carcinoma in future, and the persons who have inflammatory bowel disease, that is ulcerative colitis or Crohn's disease, may have gallbladder carcinoma in future. So number one, the most important risk factor is the cholelithiasis, that is gallstones and cholecystitis. Second is chemical carcinogens. Most important is rubber industry. And in the miscellaneous, you can say people having inflammatory bowel disease and the person who have previous surgery on the biliary tract. These are the 3 important risk factors for gallbladder carcinoma. Now site. So among the site, first you have to understand the various parts of the gallbladder. Have a look on the gallbladder. Let me highlight the margins of the gallbladder. Can you see this is the gallbladder? In the gallbladder, we divide the gallbladder into 3 portions. So this portion is known as fundus, this portion is known as body, and this portion is known as neck. So we divide the gallbladder into 3 portions. So most commonly, the malignancy, the cancer in the gallbladder occurs in the fundus, followed by neck. So less commonly it occurs in body. So fundus followed by neck. That is the most common site among the gallbladder. Now coming on the gross. In the gross, there are 2 different patterns are there. So one of the pattern occurs in one person. So what are the 2 patterns? The first is infiltrating type. In infiltrating type, there is irregular area of diffuse thickening and induration of the gallbladder wall. There is no mass. You can see the entire gallbladder wall get thickened. So there is irregular thickening in the wall of the gallbladder. Irregular diffuse thickening in the wall of the gallbladder. So that is the gross. That is infiltrating type. But in fungating type, there is a cauliflower-like mass. Can you see this mass? A cauliflower-like fungating irregular friable mass is seen. A cauliflower-like fungating mass which is protruding into the lumen of the gallbladder. Here there is no mass. The entire wall of the gallbladder get thickened. So this is the gallbladder and this is the gallbladder. So in infiltrating type, the wall of the gallbladder get thickened and there is irregular thickening in the wall of the gallbladder. There is no mass. But in fungating type, there is a cauliflower-like irregular mass that is protruding from the wall into the lumen like this. So you can see the 2 patterns in front of you. This is infiltrating pattern. This is fungating pattern. In fungating pattern, the cauliflower-like mass that is protruding into the lumen of the gallbladder. You can see the 2 patterns. Now coming on the microscopy. In the microscopy, there are 3 patterns. Most common pattern, 90% gallbladders are adenocarcinoma. You can see the tumor cells are arranged in